In Chapter 8. This lecture we're going to talk about voice disorders and the types and characteristics. We'll talk about our evaluation and the treatment for voice disorders. So as a reminder, we're here at the very bottom of our triangle, right? We're talking about phonation, but that can also be affected by respiration, or vice versa. Phonation can affect respiration if there's a structural change. So just to kind of clarify things for you, when we talk about things like length, tension, and mass, hopefully this image will give you a better idea of what we're talking about. So this image here on the left is actually a posterior or back view of the larynx, and they've kind of cut it in half so you can see it through the middle. So this area right here that the circle highlights is the vocal folds. And so when we talk about mass, this is the mass of the vocal folds, this entire area here. And then again on this side, and these are the vocal folds that come together. So if we kind of pull that out of the larynx, what you'll actually see is this entire portion here. This is one vocal fold, and it's made up of many different layers, and that's what makes up its mass. When we're doing an endoscopic exam or looking at the vocal folds from above, this is the picture that we see. So it can be misleading to think that these are just kind of very thin bands of tissue. They're actually very thick. So this vocal fold, all we really see is the edge on the top of the vocal fold, but it continues on low into the larynx. So remember we talked about two characteristics of voice and how they can be changed. We have pitch that's affected by the mass, the tension, and the length. So look at this picture over here. During a low pitch, these are the vocal folds. From that posterior view, you can see they're very thick. And then when those vocal folds go to a higher pitch, they're thinner, but you can see there's also less mass. So more mass, lower pitch, less mass, higher pitch. Low tension, lower pitch, high tension, higher pitch, and then long vocal folds give us a higher pitch, shorter vocal folds give us a lower pitch. Okay, so hopefully that'll help you a little bit more to see where those terms are coming from. And then of course we have loudness, and that's that buildup of air underneath the vocal folds. So this area right here, when the vocal folds close all the way, that air pressure builds up and then really forces its way out of the vocal folds on release. So why is this all important? So changes to the quality of the voice, or changes to our length, tension, and mass can affect the perception of someone's voice quality. And sometimes that's because someone wants their voice quality to change. Maybe they want to speak in a lower pitch, or they want to speak in a higher pitch, or they want to sound really excited. But sometimes it can also be because of a medical problem. So when we talk about voice disorders, we have to think about all the people that are involved in voice disorders. So 30% of the population have a voice problem at least once in their life, and it varies by age. So 3 to 10% of school-age children can experience a voice disorder. 7% of adults aged 21 to 66 can experience a voice disorder, and then 29% of adults 65, I'm sorry, that age is incorrect, but I'll fix that later. I believe it's 65 to 75 experience a voice disorder. And then for gender, women are more likely to experience a voice disorder than men. So why does this all happen? There's kind of lots of different ways. There's a very complex relationship between our behavior and our vocal fold pathology. So if you think about how our behavior can affect our vocal folds, when we're excited, our voice changes. When we're mad, our voice changes. When we're yelling, our voice changes. And that can affect the way that the vocal folds work and their overall function, and how well they can stay healthy when they're under different types of abuse. So if you look at this diagram over here on the right, sometimes you can view it multiple ways. So we have one way where we say tissue changes result in a voice disorder that causes personal and work problems, and that can lead to vocal abuse. The other way to look at this chart is to say vocal abuse causes tissue changes, which gives a person a voice disorder and causes person work problems with their voice use. So we'll classify that two different ways. And that is based on the cause. So we can have a functional cause where there's no tissue change, or an organic cause where there is a tissue change. And overall, what that results in is dysphonia. And dysphonia is just a fancy way of saying a voice disorder. So remember, we're talking about phonation here, and that's kind of the key word in this term, phonia. And then disorder, we have dys. And we describe our voice disorders or dysphonia according to the pitch, the loudness, and if the person has a breathy, hoarse, or harsh voice. So our two causes for dysphonia are functional and organic. For a functional voice disorder, it is a disorder of use or function. It can be psychogenic, meaning that there is some type of unconscious or behavioral disorder without any type of neurological or structural problems. So that can be vocal abuse. It can also be something like puberphonia, where a male talks in a very high pitch. Doesn't mean that something's wrong with his vocal folds. It's just kind of an extenuation of that high pitch that it can occur during puberty. And then for vocal abuse, there can be muscle tension dysphonia or paradoxical vocal fold motion impairment, and we'll talk about those in class. For organic voice disorders, there is a structural deviation or disease. So something has happened to the vocal folds or along the neurological path to cause a problem with the overall function of the vocal folds. So that can be paralysis of the vocal folds because of damage to cranial nerve stem. There can be a laryngeal web, where there's a web of tissue spanning across the left and right vocal fold. There could be trauma to the vocal folds. There could be cancer or a papilloma. There could also be vocal folds as a result of abuse. So the functional voice disorders can actually tie into our organic voice disorders, in that two types of organic voice disorders are caused by abuse, and that's the polyps and the nodules. And I want you to just know these, and you'll read about these in Chapter 8. And they'll go into detail for those, and I want you to be prepared to talk about these different types in class when we look at videos and images. When we're classifying voice disorders, so we have our causes, what was that underlying etiology or that cause of the voice disorder? Now we have to characterize that voice. And so we can characterize it according to the disorder of pitch or a disorder of loudness. Does the person talk too low or too loud? Or is their voice a lower pitch or a higher pitch? Do they talk like this all the time? Or do they talk like this all the time? And then we have the overall vocal quality. They could have a breathy voice that's caused by incomplete closure of the vocal folds. They could have a harsh voice quality that's irregular vibration of the vocal folds, or a hoarse voice quality, which means that it is both breathy and harsh. So there is a leakage through the glottis because of the incomplete closure, and there is irregular vibration. So for treatment, we have to do a very thorough evaluation first. So when a person comes to us for a voice evaluation, we don't just listen to their voice and characterize it. We also have to look at the vocal folds and either confirm or add to our initial impression. So we get an initial medical history to see if there's any reason that their vocal folds could be changed in any way. Do they have a history of cancer? Do they have any symptoms of cancer? Do they have any previous surgeries that could cause damage to the vocal folds, either by being hit by the intubation tube or by the surgery itself damaging the cranial nerve? And then during our imaging evaluation, we do endoscopy with stroboscopy. So endoscopy is the pictures that I've showed you of the vocal folds before. It's an image where we can see the vocal folds vibrate, but we can't see them vibrate very well. And that's because, remember, we have cycles per second, and the vocal folds vibrate very quickly. And when they vibrate very quickly, it becomes kind of a blurred image on the endoscopy, and we can't see exactly how they function. So during stroboscopy, we turn on a strobe light, just like you'd have at the club, and that strobe light syncs with the vocal fold vibrations and gives us a better picture of the vocal fold vibrations. So it doesn't actually line up with every single cycle per second, but it does give us the impression that the vibrations have slowed down. So you can see in this picture on the right that we have a much clearer image of the vocal folds and actually a little bit of a deviation on these vocal fold edges that isn't a normal structure. So in this case, this is an organic voice disorder because there's structure to the vocal folds. As speech pathologists, we also conduct a phonatory and aerodynamic assessment. So we conduct a voice assessment that gives us numbers related to the voice production. So we look at the loudness and the pitch, and it gives us numbers, and we look at the range of a normal, healthy adult and compare those. We also look at the aerodynamic. How does the air flow through the vocal folds? We do a case history where we identify any abusive behaviors that could have caused this voice disorder, and then we identify where the voice disorder is causing problems within their life. So is it affecting their work? Is it affecting their ability to socialize? If they're singers or not singers, does it affect their ability to sing? During treatment, we educate voice use and talk about breathing and voice coordination. We teach vocal hygiene and promote good habits, including hydration and consistently taking reflux medications if appropriate. Sometimes we also recommend resting their voice so that the vocal folds have time to heal and repair. We maximize vocal posture, so we work on breathing, releasing any tension in the larynx, and reducing the effort it takes to speak. And then we provide exercises for that breathing and the muscles and getting that voice most efficiently out of the larynx. And we also can use technology such as the VisiPitch for visual reinforcement, and I'll show you that in class on Tuesday. So for this class, we went over the different types of voice disorders. We have our functional and organic. We also went over voice disorder evaluation. We have our imaging, our medical history, our phonatory and aerodynamic assessment, identifying any abusive behaviors and identifying voice needs. And then for treatment, we give vocal hygiene, educate on use, and maximize the vocal posture. So before you come to class on Tuesday, I want you to read Chapter 8. It's going to give you kind of the definitions and characteristics of the disorders that I gave you in this lecture. I want you to know those characteristics for each type of voice disorder and be prepared to discuss them in class. It might be helpful for you to make a chart ahead of time so that you can have a quick reference. And then we'll also have a brief lecture in class, and I'll post that on Moodle for you so you can go through it with us in class.